Well, good morning, everybody. It's morning here. I hope everyone is doing well. We are going to be talking about irritable bowel syndrome today. I appreciate everyone joining. I hope everyone is doing okay. And I definitely want to preface this by acknowledging the awkwardness and uncomfortableness of this conversation. I know a lot of times when I'm visiting with my veterans, this subject is very uncomfortable, and I understand that, and it's frustrating for me as well because our treatment modalities aren't fantastic yet. I want to just acknowledge the frustration and challenges that you face in dealing with irritable bowel syndrome. But we're going to talk about it today. And for those of you who may be curious, is this something that I'm maybe even struggling with? It's been, having some awkward feelings. We're going to kind of go through that. But please know, you're not alone, and it is frustrating. So please just know that you're not alone. But we'll get started. Irritable bowel syndrome. I'm probably going to be referring to it as IBS from here on out. But that's what it is. Irritable bowel syndrome. It's a functional disorder of the gastrointestinal tract. It's classic symptoms are chronic crampy abdominal pain and altered bowel habits. So diarrhea, constipation, diarrhea alternating with constipation back and forth. Sometimes it predominantly is diarrhea. Sometimes it is predominantly constipation. Sometimes it's predominantly all over the board and mixed. And one of the things that I think is important is that a small minority of patients seek medical attention for irritable bowel syndrome. As a matter of fact, approximately 40% of individuals who meet the diagnostic criteria for irritable bowel syndrome do not have a formal diagnosis. And that's going to be important for you because if you do not have a formal diagnosis, you cannot get a Nexus letter or even be referred to the Nexus team. So if you are one of these individuals suffering from bizarre bowel habits with crampy abdominal pain, it is worth it to be evaluated for irritable bowel syndrome. It is one of the higher costs associated in healthcare. It also is a large reason that people miss work. And you can understand why. If you're having diarrhea, very awkward and uncomfortable to try to go to work. In the United States and North America in general, 10 to 15% of people are afflicted with irritable bowel syndrome. Interestingly, 25% of patients with IBS are under the age of 50. And so this is not an age-related disorder, which is somewhat of a misconception. The other thing is that females, for whatever reason, are affected more than males, at least in the studies that we have. Now, also important is that IBS is associated with other medical conditions. Now, this is an association. It's not a causal effect, but associated with medical conditions such as fibromyalgia, chronic fatigue syndrome, GERD or gastroesophageal reflux disease, functional dyspepsia, non-cardiac chest pain, and psychiatric disorders such as depression, anxiety. And that is important because I know a lot of my veterans aren't just dealing with one medical problem. And so those are some of the medical problems that are associated with irritable bowel syndrome. Now, symptoms, like we said, are classically crampy type diffuse abdominal pain and coupled with diarrhea and constipation, or alternating back and forth between diarrhea and constipation. Most of the pain that you would experience is crampy, and it does vary widely. Sometimes people say it's predominantly below the belly button. Sometimes it's predominantly above the belly button. So the pain is wide and varied. And I use the description of crampy. However, I'll tell you that some patients describe it as sharp. Some patients tell me they feel like they're getting stabbed. Some patients feel like they're bloated. So there's this pressure sensation. So the description of the pain is also varied. The literature, you'll see the word crampy used, but I'll tell you that is not all encompassing because many of the patients have multiple descriptive terms to describe the pain that they experience in the abdomen. Oftentimes the pain is associated with defecation. However, sometimes the pain is relieved with defecation. So again, a lot of variability there, which makes the diagnosis somewhat challenging, but it also makes it tricky for the patient because you're probably confused as much as anyone about like, well, wait a minute, I'm having all these different types of things going on. And that's where I want to encourage you to seek out a medical professional to be evaluated if you're having these symptoms. Again, abdominal bloating is common. Increased gas is also common. You can have diarrhea, you can have constipation, you can alternate back and forth between the two. And often I will tell you, the stools are, sometimes they're loose, sometimes they're hard. It varies. And that is a classic description of irritable bowel syndrome, is that type of variability. Now, one thing that is important with regard to the stools, blood in the stool is not associated with irritable bowel syndrome. So if you're having blood in the stool, I do want you to go see your primary physician to determine if you need a gastroenterology referral. So bloody stools are not associated with irritable bowel syndrome, and that is important. Now, blood in the stool can be very dangerous, or it can be not so much, whether it's hemorrhoids or a fissure, or there's a huge range. So that's why you need to be evaluated in person formally if you're seeing blood in the stool. Now, IBS has a very unclear etiology. We don't really know what causes it. There are a number of factors that are being evaluated. Investigations are ongoing. But as far as the underlying pathophysiology for IBS, we just don't know yet. And that's one of the frustrating things. Now, any of the patients out there who are experiencing this chronic abdominal pain associated with these change in bowel habits, so I'm talking the diarrhea, constipation, alternating back and forth, or predominantly one or the other, would benefit from an evaluation by a medical professional to determine if irritable bowel syndrome is appropriate for you. Now, the four predominant forms of IBS are going to be irritable bowel syndrome, predominantly with constipation, IBS predominantly with diarrhea, IBS with what they call mixed bowel habits, so alternating back and forth between diarrhea and constipation, and then IBS unclassified. Like I said, there's a wide gamut of what IBS looks like. So I might talk to one patient who describes it one way, and then another patient with IBS describes it very differently. Both are irritable bowel syndrome. So again, important to be evaluated for that. Laboratory testing for IBS. It is somewhat of a diagnosis of exclusion. So when we're evaluating you and having the discussion, there are specific questions we're going to be asking. And largely, many of those questions are going to be geared to trying to rule out other dangerous etiologies. So let me spend a minute just to talk to you about alarm features, so red flags. So if we're talking to you, and these aren't necessarily damning issues, but if you fall into this category, you have a higher risk of something more dangerous. And again, irritable bowel syndrome is aggravating, irritating, emotionally taxing. As of yet, we haven't found that it is dangerous per se. Now, it could be dangerous in the sense that if you're having so much diarrhea, you're losing electrolytes and dehydrating. So there is that component of it, but it is not clearly associated with any other dangerous pathology at this time. Now, obviously, they're still studying this, looking into it, but red flags are things for patients who are over the age of 50. Blood in the stool. So like I said, blood in the stool is not associated with IBS. Predominantly experiencing nighttime diarrhea, progressive abdominal pain, which again, that's kind of a tricky one too, because a lot of these are changing in the moment. So again, an evaluation is recommended. Unexplained weight loss. And I'm not talking a few pounds here and there. And I'm also not talking, again, unexplained. If you are working out and sticking to a diet and you are intentionally trying to lose weight, that is not unexplained weight loss. But if you're losing 20, 30 pounds in the span of a 2-3 week period, that's unexplained. And that's somewhat concerning. So again, I want you to see a medical professional about that. And then again, any laboratory abnormalities, which we want you to be evaluated for as well and have that addressed. Um, Also, any family history of colorectal disease or cancer, it could potentially be merit a further workup to again rule out more dangerous pathologies that allow you to say, okay, this is more likely irritable bowel syndrome. But if your mom and or dad had colon cancer, that's something I want you to get evaluated for by a gastroenterologist before we start thinking, oh, okay, this is probably. I mean, it might be IBS, but with having that family history, just want to be on the safe side and make sure. Treatment wise, and this is where I will tell you, I get frustrated as a physician because there's not great treatment options. Now, one of the things that I will tell you I think is important is establish a good relationship with your primary physician, to the point where you can be candid about, hey, look, I'm having these bowel changes. It is very awkward and uncomfortable to talk about, but I promise you, it's not that big of a deal to talk to it like with your physician. We hear about it all the time. It don't think that it's a big deal to us. It is a big deal because we want to make sure that we're doing everything we can to help you. So we're going to be talking to you about things like diet and exercise. And I know those are cliche terms, but honestly, it makes more of a difference than any other thing we can do. Now, there are some medication treatment options that I'm not going to go into today because they're very patient specific. And I want you to be talking to your private physician and or your gastroenterologist. But things like making sure you're paying attention to, fruits, vegetables, limiting the carbohydrates and sugars that you eat, drinking adequate amounts of fluids, specifically like water, so that you're staying hydrated. Exercise, regular exercise, and I'm talking 30-40 minutes a day for 4 or 5 days a week. Those things make a huge difference. And I'm not saying you have to train for a marathon, but even walking around the block for 30 minutes, it makes a big difference. It really does. It makes a difference not only in your physical health, but in your mental health as well. Does it cure you? No, not necessarily. But again, the frustrating thing about this is I don't have it's this is not like a, hey, you broke your bone, I can set it back, it's going to heal, you're going to be good to go. It's not quite like that. As a matter of fact, the prognosis is not necessarily encouraging. Somewhere between 30 and 50% of patients in the most recent studies report unchanged symptoms over time. So that is somewhat frustrating. But again, I recognize that frustration and I want to encourage you that you are not alone, and also encourage you that making changes in diet and exercise still will benefit you. And I do want to encourage you to make those changes. Hopefully, this gives you a little bit of an overview of irritable bowel syndrome. Again, I know it's a frustrating diagnosis for any of you who are suffering from this. Um, it is frustrating from my standpoint too, because I don't have some sort of magic pill that I can give you that really helps. My hope is I can give you some encouragement to get out there, diet, exercise, recognize that you're not alone, and then hopefully get you plugged into the right person. And if that right person is a gastroenterologist, then that's okay. And also keep you safe. Make sure that if you do have one of those alarm features or the red flags, that we're not ignoring that and just saying, oh, it's probably irritable bowel. No, we want to get that looked into so that because if it is one of those other things and we can address that, that's a whole different story. So I'm going to stop talking now since I've been jabbering for a while. See if there are any questions that are out there that I can answer. So the best way to get started with telemedica is going to be going to the website or the phone number, and we'll put that link as well. So, yep, there's the website. And they will plug you in with one of our providers so you can get evaluated. And it's really a pretty simple evaluation. We've got a handful of questions that we're going to ask. And honestly, most of you know exactly what you've been struggling with, and you can communicate that. And this is the email address and the phone number where you can call to work on setting up an appointment. And the important thing with our interview with you when we're talking to you is to establish if you have anything that we would consider an alarm feature or a red flag, because we do want to make sure that we're keeping you safe, and that we're referring you to the right place. So it shouldn't take too long or be too difficult. Please don't be embarrassed, because we hear it all the time, and that's where I want to, again, you are not alone. We deal with many veterans, many patients who struggle with this, and want to just encourage you that the best thing you can do is reach out for help. I mean, that's really the best thing you can do. And there are a significant number of persons who are not reaching out for help. So it is something that I want to encourage you to do, because if you do meet the criteria for irritable bowel syndrome, we can plug you in with our Nexus Letter team, and they can start working on seeing if you qualify for service connection, because that's, step one is just getting the diagnosis. So I always recommend a Nexus Letter. I am not writing the Nexus letters, so I might defer that. But in my conversation with my colleagues who do the Nexus Letter work, they have impressive data on the amount of people who are successfully connected with a Nexus Letter as opposed to without one. So I always recommend that. But again, you can certainly talk to someone on our Nexus Letter team. But I will tell you that a vast majority of people who are unsuccessful with service connection didn't have a Nexus Letter. So for diagnosis, you could go to the VA if you wanted to for your primary doctor. You can also go to Telemedica, because we can diagnose this through telemedicine platform, which is one of the nice things about telemedicine is you can log on through Telemedica, and we can have an appointment at your convenience. You can do it at home, at the office, in the car. I mean, and so we're as flexible as we can be with that. But certainly, any licensed provider could evaluate you for this. I just want you to make sure you're getting evaluated. I would start. So the question is about a specialist versus a primary care physician. I would start with a primary care physician, because that you may be able to get your diagnosis from a primary care physician and not need to go to the gastroenterologist or the specialist. The primary physician can direct you to the specialist if you need to go there. I guess if you already had an established relationship for whatever reason, you could start there. But if you don't, I would recommend starting with your primary physician. So if you have a conversation with your physician who says your symptoms are controlled with meds, I think the conversation just needs to be candid. Are your symptoms actually controlled with meds? Because there's a vast amount of literature out there that says that not everyone has benefit with medications. If you are benefiting, okay, that's different. But if you're not getting benefits and you've been on medication that your gastroenterologist has put you on for months and months, I'm I think you should push back and say, look, yeah, you put me on this medicine, but I'm not benefiting from it. I'm still having these symptoms. It hasn't impacted my life in any way, shape, or form positively. So I think you just need to, have that candid conversation, and you may also have to, be on the medications for several months before you can make that argument stand. But I think if you're not getting benefit from medications, you need to just be clear about that when you're meeting with your physician. Now, if you are getting benefits, that's actually great. That's great. But again, it may impact your how the VA views you from that standpoint too. No, oftentimes if you get a CT scan with IBS, you're not going to see anything, good, bad, or ugly. It's not going to show up, and that's somewhat it's somewhat diagnostic in a weird way, because I don't expect to see anything abnormal in the CT scan. Irritable bowel syndrome is not going to show some sort of physical pathology. And that's a good thing because what they're looking for oftentimes are more dangerous pathologies. So I don't expect anything to be seen on the CT scan in a patient with irritable bowel syndrome. So let's see. The prices that we have, I will refer you to the Telemedica website, so they can plug you in with their prices, because that's the best way to go about it. I will say so far we've had a lot of good questions. Some of the previous ones that we've done, and maybe a little more straightforward. We've had some good questions today, so hopefully this has been helpful for you, and you've been able to get some, at least some information to get you started. So, but any other questions? And certainly don't hesitate to reach out via email if you think of other questions later today or tomorrow. We're happy to try to get back with you if you think of other questions down the road. And again, here's the email address and the phone number below, so you can either shoot us some questions, or if you want to work on scheduling an appointment, we're happy to get you set up so you can be evaluated. But don't hesitate to reach out if you think of questions later on. I know we're kind of putting you on the spot, so. Well, it looks like we are good on questions. Again, please don't hesitate to reach out via email or phone if you've got other questions. We're happy to answer those questions. Happy to get you set up with an appointment. But again, look forward to trying to help all of y'all. Please be encouraged. You're not alone. I know this is an awkward conversation and it's an uncomfortable. It can be embarrassing. Try not to let it get you down. Do see someone, whether it's us or someone else, to work on getting, at least maximizing your outcomes. And a lot of it is challenging. So you're not alone. Please be encouraged and keep going. So hope you all have a great day. Thanks for phoning in, and we'll look forward to seeing you next time. Take care.